Contraceptive methods. Family planning methods serve as a cornerstone of reproductive healthcare, offering individuals and couples the autonomy to make informed decisions about their reproductive journey. What are contraceptive methods? Contraceptives, also known as birth control methods, are a class of medical interventions or devices used to prevent or decrease the likelihood of pregnancy. These methods work by interfering with the process of conception, either by preventing the release of an egg, ovulation, blocking the fertilization of an egg by sperm, or creating a hostile environment for the implantation of a fertilized egg in the uterus. Natural family planning. The natural family planning methods do not include any chemical or foreign body introduction into the human body. Abstinence. This natural method involves abstaining from sexual intercourse and is the most effective natural birth control method with an ideal 0% fail rate. Calendar method. The calendar or rhythm method. Also called the rhythm method, this natural method of family planning involves refraining from coitus during the days that the woman is fertile. Basal body temperature. The basal body temperature is the woman's temperature at rest. BBT falls at 0.5 F before the day of ovulation, and during ovulation, it rises to a full degree because of progesterone and maintains its level throughout the menstrual cycle, and this is the basis for the method. The woman must take her temperature early every morning before any activity, and if she notices that there is a slight decrease and then an increase in her temperature, this is a sign that she has ovulated. Cervical mucus method. The basis of this method is the changes in the cervical mucus during ovulation. Symptothermal method. The symptothermal method is simply a combination of the BBT method and the cervical mucus method. The woman takes her temperature every morning before getting up and also takes note of any changes in her cervical mucus every day. Ovulation detection. The ovulation detection method is an over-the-counter kit that can predict ovulation through the surge of luteinizing hormone that happens 12 to 24 hours before ovulation. Lactation amenorrhea method. Through exclusive breastfeeding of the infant, the woman is able to suppress ovulation through the method of lactation amenorrhea method. Contraception. Coitus interruptus. This is one of the oldest methods of contraception. The couple still proceeds with the coitus, but the man withdraws the moment he ejaculates to emit the spermatozoa outside of the vagina. Hormonal contraception. These hormonal contraceptives are effective through the manipulation of the hormones that directly affect the normal menstrual cycle so that ovulation would not occur. Oral contraceptives. Oral contraceptives. Also known as the pill, oral contraceptives contain synthetic estrogen and progesterone. Estrogen suppresses the FSH and LH to suppress ovulation, while progesterone decreases the permeability of the cervical mucus to limit the sperm's access to the ova. Transdermal patch. The transdermal patch has a combination of both estrogen and progesterone in a form of a patch. Vaginal ring. The vaginal ring releases a combination of estrogen and progesterone and surrounds the cervix. This silicone ring is inserted vaginally and remains there for 3 weeks, then removed on the 4th week as menstrual flow would occur. Subdermal implants. The subdermal implants are 2 rod-like implants embedded under the skin of the woman during her menses or on the 7th day of her menstruation to make sure that she is not pregnant. It contains etonogestrel, desogestrel, and progestin. Hormonal injections. Depo-Provera. A hormonal injection consists of medroxyprogesterone and progesterone and is given once every 12 weeks intramuscularly. The injection inhibits ovulation and causes changes in the endometrium. Intrauterine device. An IUD is a small, T-shaped object that is inserted into the uterus via the vagina. It prevents fertilization by creating a local sterile inflammatory condition to prevent implantation. The device contains progesterone and is effective for 5 to 7 years. Chemical barriers. Chemical barriers such as spermicides, vaginal gels, creams, and glycerin films are also used to cause the death of sperms before they can enter the cervix and also lower the pH level of the vagina so it will not become conducive for the sperm. Diaphragm. A diaphragm works by inhibiting the entrance of the sperm into the vagina. It is a circular, rubber disc that fits the cervix and should be placed before coitus. Cervical cap. The cervical cap is another barrier method that is made of soft rubber and fitted on the rim of the cervix. It is shaped like a thimble with a thin rim, and could stay in place for not more than 48 hours. Male condoms. The male condom is a latex or synthetic rubber sheath that is placed on the erect penis before vaginal penetration to trap the sperm during ejaculation. Female condoms. These are also latex rubber sheaths that are specially designed for females and pre-lubricated with spermicide. It has an inner ring that covers the cervix and an outer, open ring that is placed against the vaginal opening. Surgical methods. One of the most effective birth control methods is the surgical method. The two kinds of surgical methods are used by either the male or the female, and would ensure that conception is inhibited after the surgery for as long as the client lives. Vasectomy. Males undergo vasectomy, which is executed through a small incision made on each side of the scrotum. The vas deferens is then tied, cauterized, cut, or plugged to block the passage of the sperm. Tubal ligation. In women, tubal ligation is performed by occluding the fallopian tubes through cutting, cauterizing, or blocking to inhibit the passage of both the sperm and the ova.